is the Zero Hour, the voice of Medicare for All. And since we are talking about Medicare for All a lot on this week's program, I especially wanted to talk with our next guest, a good friend of the program, good friend of ours, good friend of Medicare for All. Nancy Altman is the chairman of the board of directors of the Pension Rights Center. She is the president of Social Security Works, and she is the author of several books, including The Truth About Social Security, The Founder's Words Refute Revisionist History, Zombie Lies, and Common Misunderstandings. And Nancy, first of all, thanks as always for coming on the program.
Thank you so much for having me.
Always a pleasure. And you wrote a piece on an aspect, there's so much to discuss about Medicare for All and why it makes sense for everyone in this country. But you wrote a piece on an angle that I think has really been neglected, that I think is really important for people to understand. It was published on the Forbes site as with the headline, "Why Seniors Should Be the Strongest Supporters of Medicare for All." So first of all, why did you write that?
I wrote it because Medicare for All is, as you just said, is going to be excellent for all of us, the nation, us as individuals, and especially seniors. The special interests that are making a profit off of our need to get health care are really at a loss for what to do. So instead of trying to argue on the merits of what's this kind of approach we should have, they simply try to scare people. And the people they try to scare the most are the ones who are most dependent on healthcare, who on average have worse health outcomes and have more chronic conditions and so forth. And those tend to be seniors or also people with disabilities. So my piece is really intended to say, don't let the fearmongers convince you this will be better for you. In fact, you're going to benefit more than anyone else from Medicare for All if you're older.
Yeah, I think this is such an important point. First of all, because, the cynics do love to turn us one against the other, to divide us. And this notion that somehow, as if there was just a fixed pot of Medicare and we can't give any to the young people because then the seniors won't be able to get it, is just such a perverse way of looking at the public good and how we can provide for each other. And secondly, because the specifics of a Medicare for All, as it's being proposed, are so good for seniors. I mean, I think this is the part, I know you and I and others have talked about, calling it improved Medicare for All or whatever. It starts to get complicated after a while in terms of terminology. But the point is, there are aspects of today's Medicare that don't reach as far as they need to for the needs of seniors and disabled people on the program. And the Medicare for All proposals do so much more that I think it's important for people to know that.
Absolutely. Well, you've really made two very important points. One is that insurance is most efficient. It works the best. It has as large a risk pool as possible, as many people as possible in the group, because after all, it is an idea of pooled risk and no adverse selection, so that simply expanding the risk pool is going to make Medicare better, but it's going to especially make it better, even without any changes to the benefits. It makes it better if you bring in healthier, younger people, because that means there are more people over which to spread the risk and the costs. But beyond that, so even if we were just adding a lot more seniors and people with disabilities, now, of course, they're now all covered under Medicare, but if they weren't, that would be an improvement. But there's an extra improvement, not just in having a larger risk pool, but in adding a number of very important benefits. Probably the most important is long-term care and services. Currently, Medicare only covers in-hospital doctor care, not long-term care either at home or in assisted care living homes and nursing homes. What we now have, we really have a system. Medicaid was intended for low-income people as a form of health insurance. But because long-term care is so expensive for seniors, you have people who have been independent middle class their entire lives, but if they go into a nursing home, the average cost is something like $82,000 a year. Most people cannot afford that year after year after year. And so what they have to do is impoverish themselves, spend their assets, become destitute so they could go on to Medicaid. And even then, depending on which state they're in, they may or may not get the services they need. They won't have full choice of facilities and so forth. So what makes the most sense is that Medicare simply be expanded to cover long-term care. There was a bill that was put in yesterday, the Medicare For All Act of 2019. It was introduced in the House of Representatives with over 100 co-sponsors, and that does just what I said. It expands it to include long-term care as well as some other benefits as well.
Well, it's interesting because I think about the experience of my own family, and my mother passed away last year, but this to me is a classic Medicare for All story. We had to struggle with her finances. She had a little bit of money that we couldn't access for her care, but other than that, we spent everything trying to make sure she was cared for. Long-term care was a horrific experience to spend down. So the current system requires you to, as you described, impoverish yourself in order to access this care. And then as the topper to the whole story, the little bit of money that we couldn't access, which was left to us upon her death, mine went to replacing I have a long-term hearing disability, went to replacing my 25-year-old hearing aids, which I otherwise wouldn't have been able to afford to replace. So you have, that to me, Medicare for All for seniors would also, and for everyone, would also cover hearing loss. For right now, hearing aids aren't covered. Vision care isn't covered. Dental care isn't covered. And most people, I was fortunate when I had, years ago when I had employee-based coverage that would cover things like hearing aids, but it doesn't anymore. And so I think you have a situation where both parents and children and grandchildren are going to benefit from all the services that aren't currently covered, from those that are covered inadequately because the co-payments and deductibles are very difficult for most families to meet, and for, in the case of seniors especially, long-term care, which is a draconian system. I mean, people don't realize it, but you may know the exact statistics. I think more than half of long-term care expenses are paid in some way or another by Medicaid right now. Is that right?
That's right. And I want to linger for a moment over this, because I think it's a really crucial point about the vision and the hearing and the dental coverage. Those are real detrimental, and loss of hearing is so significant for people who have both sight and hearing. A lot of people are visual and think, oh my gosh, it would be awful to go blind, and it would be awful to be blind, but it's worse to be deaf because it's very isolating. It really cuts you off from social interactions. We actually use our hearing quite a bit in balance and walking, and it means much greater risk of falling and therefore being in the hospital. It's linked to depression, not surprisingly, and recent research by Johns Hopkins shows that it actually untreated hearing loss results in the atrophy of the brain and brings on more likely to suffer dementia. Right. So these are very, very serious, and they're easily treated. There is surgery that can treat that for the most serious problems, and they're very sophisticated, more and more sophisticated hearing aids, but those cost thousands of dollars, and most people just can't afford that. So that loss of hearing is quite prevalent. I think it's nearly 1 out of 2 people age 75 or older have severe hearing loss. It's 1 out of 3 for people 65 to 74, and yet most of those people don't have it treated. It's untreated hearing loss. Dental issues. Oh, go ahead.
And I just have to say parenthetically from my own observations that there's a weird sort of insensitivity sometimes that comes in with the health care of older people. When I was in my 30s and I needed assistance with my hearing, it was treated as a medical problem. When your hair turns gray and you need help with your hearing, it's, old people, But the fact is, it has all these health consequences that you described. So, and it's terrible to be socially isolated. Mine wasn't that severe, but it was severe enough. The cognitive associations that go along with it. It's just interesting how people are sometimes willing to accept the limitations of care for certain populations when it's really wrong to do that.
Well, and I think it's a lack of imagination. For those of us who were fortunate enough to be born with hearing and vision and could afford, lived in families that could afford dental care and so forth, you think of it as, you just put on some glasses and everything's fine. But that's just not the case. Macular degeneration, there are all kinds of visual problems that are not easily treated and that are extremely debilitating. There are treatments for them, and it's something that can happen to any of us or any members of our family, and we should be willing to pool our risk and add these benefits, and that's just what Medicare for All does. So it's extremely affordable. Same thing is true with dental work, that there's some people in our society are suffering from severe malnutrition because of their dental problems, and it doesn't just affect older people. It's more likely to affect older people, but I was on a panel with a younger woman who did not have adequate medical care, had a child who was born with a number of severe conditions, so the family money, to the extent they had, were able to afford care, were going to the child. She had a root canal, couldn't get it treated, waited about 6 months, and she was in her 30s, had to get all of her teeth pulled. She now has false teeth. And that is lifelong. That has lifelong consequences, and it would be so easy to have treated it. All of that is preventable. And in fact, in some ways she was fortunate, because what happens often with those kinds of untreated gum conditions in particular is it can lead to heart problems. It can lead to pneumonia, lung problems, because it's bacteria that gets in the bloodstream and then can get anywhere in the body. So it's those of us who haven't suffered from those conditions and have had excellent hearing and sight and had regular dental care, we often don't realize just how debilitating it is, but how easy it is to treat if we catch it early. And that's the point of Medicare for All, that covers all of these conditions. If I can make just one more point, there are so many people who are age 62, 63, 64, who are just hanging on to get to age 65. And when they get to age 65, they had very treatable conditions that then become worse. And they get treated, but it's much more expensive. If we had Medicare for All, it would save money for everyone.
What occurs to me in listening to you, Nancy Altman, is that Medicare for All the phrase to me now doesn't just mean Medicare for everyone. It means Medicare for all of the human body and mind as well, because we have this weird kind of division that we take for granted, but that's really irrational in our healthcare finance. Why are teeth not as much a part of your body that should be insured as your wrist if you break your wrist, or your leg if you break your leg? No, teeth, no, we don't cover that part. Eyes, no, they're out. It's like this weird kind of like taking the body parts and saying, okay, you get to stay, you have to leave. It doesn't make any sense. It's all one organism, and all, including, you know, psychiatric care, the mental state, and should be treated as such. And that's one of the things Medicare for All does. We're kind of out of time, but I just want to, before we go, maybe give you the chance to say a final word about why it's not just for seniors, for example, who are on Medicare today. It's not just for the sake of their children, grandchildren, or friends and neighbors who are younger than them that they should be fighting for Medicare for All, but they're going to be way better off. And I'll give you the last word on that.
Way better off. Currently, 40% of the average Social Security benefit goes to paying healthcare costs, out-of-pocket healthcare costs, because even though we've got Medicare, there are substantial copays, deductibles, premiums, treatment, the kinds of things we were just talking about, dental work that's not covered, and so forth. What Medicare for All does will save all of us. It eliminates all premiums, copays, deductibles. As a society, as a nation, we will be paying much less. So when people say, how can we afford Social Security? I think there are two answers. One is, how can we afford not to have Medicare for All? And the other is, it's not a question of it costing us more money. The question is, how are we going to divvy up the savings? Who gets how much of the savings? Because there will be savings if we are smart enough to enact Medicare for All.
Okay, and well, unfortunately, we will have to leave it there. But Nancy Altman, president of Social Security Works, author of a number of books, including The Truth About Social Security. As always, great to talk to you. And as always, thanks for coming on the program.
Thank you again so much.
And